Now at GMA Health Alert, there's a new report out on the popular painkiller acetaminophen, often sold under the brand name Tylenol, but it's in hundreds of drugs. Between 2001 and 2010, more than 1,500 people died from accidental acetaminophen overdoses. ABC News senior medical contributor Dr. Jen Ashton is here this morning.
Good morning, guys.
Yeah, we appreciate you coming in. So this is not a new issue. What's going on? Are people not getting the message?
You're absolutely right. It's not a new issue. The problem is that both patients or the lay public, the consumer, as well as the medical community, the message is not getting through. And we're talking about preventable deaths here. So this is something that, as you said, is in hundreds of medications, both over the counter and prescription. And people need to know the number, the maximum daily dose, which is 4,000 milligrams in a 24-hour period. And if necessary, they need to get out a calculator, add up what they're taking, or ask their pharmacist or their physician, because this can kill. And even a small amount, you guys, over that 4,000 milligrams can cause liver failure or be deadly.
Yeah, it's such a popular and prevalent drug. What happens if, in fact, you do overdose?
Well, first of all, the liver is the major metabolic organ in the body. So initially, short term, you'll have nausea, vomiting. Then you can have no symptoms for a while as the blood abnormalities start really kicking in. And then it can lead to coma. So this is something that needs to be taken seriously. And if you're on pain medication or if you're taking multiple over-the-counter medications, you need to look for this ingredient, acetaminophen, and do the math, add it up. I tell my patients, try to stay in the 3,000 milligram range just to be safe, and no alcohol when you're taking acetaminophen.
No alcohol whatsoever.
I think you want to err on the side of caution. I mean, we're talking about 150 deaths a year that are unnecessary.
Even if you sprained your knee and you're taking a couple Tylenol.
No drinking.
Interesting.
Better safe than sorry.
It's also important to read the label as well.
Read the label or ask pharmacists. They're a huge resource and we're not using them enough.
Dr. Ashton, great to hear from you. Thanks so much for coming in.